Neuralmed is a Brazilian startup that is the result of a spin-off of a Brazilian radiology group. It was founded by myself, Anthony Eiger, and Dr. André Castilla. We were both working at the same radiology group and noticed that there was space to improve radiology through the implementation of artificial intelligence. Neuralmed develops AI-based software tools that make radiologists more efficient while at the same time lowering their error rate. Our vision is that in the near future, all radiologists will have AI-based software aiding their work, making healthcare less expensive and at the same time more accurate. We decided to focus our business on X-rays because the numbers in this market are just too big to ignore. The World Health Organization estimates that in 2017, 3.6 billion X-rays were performed. This number on its own is enormous, but when you consider that they also estimate that only 1/3 of the world has access to X-rays, it is even larger. The United States alone performed more than 500 million X-rays. Brazil performed over 100 million. The problem is that there are only 34,000 radiologists in the United States and 12,000 radiologists in Brazil. This problem gets worse in more impoverished countries like Kenya, for example, a country of 43 million people that has only 200 registered radiologists. Mass General in Boston has 190. Basically, there are too many exams and not enough radiologists. To add to this, studies show that false negative rates are very high, ranging around 20 to 30%, reaching up to 70% in some cases. These numbers can be lowered when AI tools help radiologists in the diagnostic process. Once we decided to focus on X-rays, we dialed in on chest X-rays, which are the most common form of X-rays, representing around 30 to 40% of all exams. We then used our very large proprietary database of images and trained our model to detect certain pathologies. This was done using NLP to dissect the report and auto-label the image. If no report was available, trained radiologists would perform the labels. Since we are a spin-off of a radiology group that reads over 1 million exams a year, we have access to this very large historical database of over 500,000 chest X-rays, giving us a large advantage over competition in the sector. Our first deployment of the product was a solution that allows emergency rooms to create a smart priority system. Our algorithms analyze all chest X-rays performed and indicate which are most likely to be critical and time-sensitive to treatment, pushing them to the top of the pile for the physician to read. In the near future, we will suggest pathologies to the radiologist, showing a heat map of where the software believes there might be a pathology. We already have some of these models in testing and should be able to apply them soon. In December 2018, Neuralmed was approved to conduct a research project at Hospital das Clínicas, testing if our AI can diagnose pathologies in chest X-rays. The hospital will grant access to all X-rays performed in their ER and clinics, as well as all exams available in their historical database. Our goal is to organize their entire database by pathology and compare our results to the results of their in-house radiologists. Hospital das Clínicas is the hospital complex that is part of the Medical University of São Paulo and is considered one of the most important hospitals in Brazil, both by complexity and size. All of this is only possible because of the amazing team at Neuralmed. I myself, Anthony Eiger, co-founded Neuralmed. I graduated Northwestern University with a bachelor's degree in economics. After I left my job in banking, I opened a startup accelerator in 2012. After a successful cycle of investments, I co-founded a mobile gaming startup that is still growing with great financials. For the last 4 years, though, I have been working in a radiology group, developing new business and searching for ways to improve productivity inside the group, which resulted in the creation of Neuralmed. Dr. André Castilla is a co-founder of Neuralmed. He acts as our chief medical officer and lead NLP developer. He is a radiologist graduated from USP and also holds an MBA in hospital administration and healthcare systems from GV, as well as a doctorate in medical information focused on NLP for X-ray reports, which he completed in 2003. He is a self-taught Python programmer and has spent the last 10 years as a coordinator for a large radiology unit and reading room, supervising a team of radiologists. Vitor Di Mario is our lead developer. He holds a bachelor's degree in computer science from UFRJ. He previously spent 4 years at Nedelix, a startup focused on using AI for genetic analysis, where he was the main developer for their first product. Before that, he was at Hewlett-Packard. Vitor is a leader of the Go community in Brazil, responsible for GopherCon Brazil. Fernanda Vanderlei is a data scientist and holds a bachelor's degree in computer science and AI from UFRJ, a master's in AI from UFRJ, and a doctorate in computational intelligence from UFMG. She previously spent 2 years at Mendelix, where she was responsible for updating the model and substituting their initial model for a more productive one. Before that, she was a professor of AI at UFRJ. Jessica Santos is a data scientist and holds a bachelor's degree in information systems from USP and a master's in machine learning and health informatics from USP, where her master's thesis involved processing eye tracking data with a model of visual attention to aid autism diagnosis. She was previously at Zap Imóveis, where she used NLP and machine learning to determine the conversion rates of real estate listings. We are excited for the future of Neuralmed with new products, modalities, and team members. Thank you.